Why don't we start off and we'll be true to our theme here, which is innovation. And I'm going to pose the first question to the panel, which is, how has your organization used or applied technology to really innovate either care or maybe the business processes behind healthcare in recently? And whoever would like to jump in on that. So the innovation question.
Well, I'll go ahead and start with that.
Okay.
And with Lumeris, as Nancy said, we were actually an outgrowth from SSM Health Care, which was the Medicare Advantage plan here in St. Louis. And what happened was, through SSM Health Care, we kind of understood how technology could be used to improve really the payer and the provider relationship. How by providing technology, providing data, providing visibility into what was occurring, you could really improve that. We called it at the time collaborative payer model. We didn't know that that was going to quickly become the accountable care movement, which has now really been pushed out there. So technology is at the center of what we do. We actually have a platform called the Accountable Delivery System Platform. And what it does for us is it really brings together all the constituents in healthcare. The payers, the providers, the pharmacies, the labs, all of those together, brings that data together, breaks down those walls between them, provides information out so that everybody has the same view of the patient, same view of what's going on. And so that's where we really see healthcare technology going, is kind of that collaboration, that sharing between different organizations, having everybody be on a single team and working toward the care of the patient.
I can pick up on that, certainly. The thrust we've had is certainly that, and the other piece I think goes with that is getting good data, good information. So we've made significant investments in business intelligence, business analytics, because we want to provide to our provider partners, to members, information. I think one good illustration of that is historically payers have been looked at as people who just pay claims. And so in the last several years, we've taken that claims data along with clinical data that we've ingested and other data and put them through various modeling engines. And so we're now able to predict members that have high risk and are at risk of future expense, future care issues. That's probably even better manifested in terms of identifying gaps in care. And so we can take data through our various engines and identify someone who's a diabetic that hasn't had a vision exam, or a woman that hasn't had a mammogram or whatever, based on their demographics, based on their history. We then, to the previous point, take that data and we externalize it through our web systems to members, to providers. We give that same data to our clinical personnel, our case management people, and we even now take that data into our administrative call center applications in an abstract form, so that if a member calls to ask for an ID card, they get an alert that pops up on our call center system that says, this member has a gap in care. Please encourage them to go to a doctor.
All of us are speaking of very similar projects in each of our companies. So I guess from a provider's perspective, we are in charge of getting that information into the system to begin with, so that these guys can pull the information out. But interestingly, we're doing the same thing within our organization so that we can model the medical home model, so that we have that coordination of care for the patient, really throughout their whole healthcare continuum. So that's whether they are an inpatient, whether they're in a long-term care facility, whether they're being seen on an outpatient basis, whether they need to have their labs drawn, to need to have a special test. We are, as an organization, making sure that we are coordinating that care, and then technology is helping us do that because the information is right there at that care manager's fingertips.
I think really the end result of what we're saying here is now we have physicians and other providers that can be proactive in the care of their patients. They're no longer just sitting there waiting for the patient to come in and say, give me a flu shot, they get a flu shot, walk out the door. Now, even if you just come in from that flu shot, the physician will know right away, well, here's a diabetic who needs an A1C taken, it's somebody who hasn't had breast cancer screening, can have a whole number of things that they can quickly address and proactively improve that care. And I know through systems we've done, even if the patient isn't coming in, they'll proactively call out and say, come on in, we need to see you. We actually have come up with a form called the Enhanced Encounter Form. I think it takes about an hour to do, but we have found that if the physician sits there with the patient and works through that, the wealth of information that you get out of that and you can feed into the system is worth it. It pays for itself 8 to 1, that hour of time. So it's really allowing the physicians to be accountable and proactive in the care of the patient.